about subtle lupus symptoms that are easy to miss. You notice a butterfly-shaped rash on your face. If lupus has a calling card, it's a sunburn-like rash that stretches across the nose and cheeks, in a shape resembling a butterfly. Its unique appearance is highly suggestive of lupus, Dr. Goldfein says. About 30% of patients with lupus get this rash, researchers say. You have a fever that just won't go away. Fever can be a sign of inflammation, and some patients may be feverish during a lupus flare. While having a fever isn't unique to lupus, if you have a fever that you just can't shake or it keeps returning, it's best to see a doctor, especially if you've noticed any of the other signs of the disease. You get rashes or sores on your skin after going outside. Very often, people with lupus are photosensitive, meaning their skin is very sensitive to ultraviolet light. Breakouts typically occur on sun-exposed areas of the body, including the face, neckline, and arms. UV light exposure can also set off lupus symptoms or trigger a flare-up of the disease. Your joints are sore or stiff. Sometimes lupus is mistaken for rheumatoid arthritis, RA, because both diseases can cause joint pain and stiffness, often in the hands, wrists, and ankles. Joint symptoms are the main feature of RA but one of many signs of lupus, Dr. Menzies says. When you wake up in the morning, you feel like the Tin Man, very stiff, can't get moving, and after you've been sitting for a while, the joints almost feel like they've got gel in them, she says. You have swelling. Swollen lymph nodes? Puffiness around your eyes? These can be a sign of lupus too. Some people will present with swelling in the legs, and the very first thing they're getting is kidney failure, Dr. Menzies says. You're losing your hair. Hair loss with lupus can be patchy, leaving little bald spots on your head. Or, it can be diffuse, causing thinning all over the scalp. Sometimes a rash develops in a balding area. Your finger or toes blanch and go numb. As many as a third of people with lupus experience Raynaud's, a syndrome that affects the blood vessels, the National Resource Center on Lupus says. When you have Raynaud's, the vessels that supply blood to your skin narrow, limiting blood circulation, especially when you're cold or under stress. You may have Raynaud's if your fingers or toes, or both, go numb and turn blue or white. You're totally wiped out. Profound fatigue is a common complaint of people with lupus. It is not the kind of exhaustion you get after exercising or playing a sport. It's the sit-a-wall, can't function kind of fatigue, as Dr. Menzies describes it. Fatigue isn't specific to lupus but may provide another clue if someone has other lupus symptoms. In a rheumatologist's mind, that's just one more confirmation that there's inflammation going on, Dr. Goldfein says. Here are 6 other reasons you may be tired all the time. Your chest hurts. If it hurts to cough or breathe deeply, it could be pleurisy, inflammation of the lining of the lungs. It's a common symptom of lupus. If you cough and the lung tissue gets pushed out against the lining, it hurts because it's inflamed, Dr. Goldfein explains. It tends to be a sharp pain. Lupus may also inflame the lining of your heart, which causes chest pain too. This type of chest pain changes based on your position. If you lie down on your back, it hurts, he says, and if you sit up and lean forward, it feels better. You have mouth sores. When I see someone who I think might have lupus, I ask them if they get sores in their mouth, Dr. Goldfein says. Ulcers, like canker sores, on the roof of the mouth or tongue or even the nose, can last a few days to a month or more, according to the American College of Rheumatology. Red dots appear on your skin. Lupus can attack your platelets, blood cells that help your body form clots to stop bleeding, Dr. Menzies explains. And when you have low levels of platelets, you can develop tiny red dots called pitachi. People will notice little red blood spots on their legs because their blood vessels are leaking blood, she says. They may also get nosebleeds or be bleeding from their gums when they brush their teeth. It suggests that the platelets may be under attack, Dr. Menzies says. Your head hurts, and you can't think straight. It's not all in your head. Lupus can attack the brain and nervous system. Up to 50% of people with lupus report problems with memory, concentration, and other cognitive issues dubbed lupus fog, says the National Resource Center on Lupus. People with lupus may be twice as likely to develop migraine-like headaches due to inflammation of the blood vessels. And when lupus attacks the nerves, they can experience numbness or tingling in the motor and sensory nerves. If a young woman in her 30s, 40s comes in with a stroke, and everyone's thinking, how could this happen? Oftentimes that'll be the onset of a diagnosis of lupus, Dr. Menzies says.